All right, we are back with another video. This is Mr. Hospital Bed Sean Callahan, and today we're going to go through and talk about Hillrom hospital beds. Now, Hillrom beds are beds that are primarily used in hospitals. We've actually got quite a few of them around us here. We've got the Hillrom VersaCare bed, which is here on our far right, camera left, and then also have right next to it the this bed right here is the Hillrom Centrella, and then we've got the Hillrom Total Care P75, not Total Care, excuse me, Hillrom P7500 Progressa, which is the best hospital bed made on the planet Earth. That's with the pulmonary mattress, that magenta one directly behind my head. And then over here, we've got the Hillrom Progressa with the treatment surface on it. And then we also have the Hillrom Progressive bed with the foam mattress. So these are some of the best hospital beds made on the planet, and they're used a lot for home care, long-term care. We're going to get in and talk about these hospital beds. And for anybody out there that's looking for a bed for long-term care, home care, anything that has to do with even hospitals, actually, international hospitals, we sell a lot of beds overseas. But we want to go through and talk about Hillrom being really one of the leading manufacturers on the planet Earth. Hillrom is probably the number one bed that's used and sold in hospitals. There is another brand, which is Stryker, and there's a Stryker bed right. This is so funny, man. Right there. Got to do everything opposite. That's actually with that orange mattress. But today it's all about Hillrom beds. And for anybody that knows, we have fully stocked showrooms. We have all these beds on display, and all these beds are available. And we ship them all over the United States. We ship them all over the world. So we're going to talk today about some of these bed models made by Hillrom, which might be the best bed model for you. Now, we also do sell beds brand new from Drive Invacare and other manufacturers, but a lot of times you're going to get a lot more value from an actual refurbished or recertified hospital bed than you might by buying some beds brand new. But the goal for us is to provide options, features, and get the right bed for the right situation. So in some cases, these might be the right one. In other cases, it might not be. Now, if you've watched some of our previous videos, some of our other Mr. Hospital Bed videos, we also sell foam and air mattresses. So foam and air, that's the first thing you're looking at when you're buying a hospital bed. And many of these beds, as you can see, can be equipped with foam or air. Now, Hillrom beds, if they are air beds, they're going to have the air system built into the bed frame. So the VersaCare bed, which is right here, this bed has the air system built into the frame. So there's not going to be a pump hanging off the foot of the bed. In some cases, it makes it a little bit more quiet. And in other cases, also, you're going to get a lot more value because when you're buying the bed frame and the mattress connected together, you're getting hospital grade quality, but probably not paying as much as you would if you went out and bought some of this equipment brand new. However, like I said, we do have both, so we do have those options. Now, the Hillrom VersaCare bed is probably one of the most popular beds we sell. Now, right now, like I said, it's equipped with an air mattress, but it can also be equipped with a foam mattress. So if you didn't need air, that would be something that you could add later. And it's always important to note that these hospital beds, once you buy them, like if you get the VersaCare bed with air, you could disable the air and put a foam mattress on it, but you can't take the bed and then switch it around later. So whatever it is that you buy it with is pretty much how it's going to be. But the bed right over here, the Centrella bed, this one, that one, although it's equipped with a foam mattress, that could be equipped with an air mattress later. So primarily, air mattresses are for people that spend the majority of time either in bed or sitting down. They're the people that are at risk of getting bed sores, pressure wounds, and that is, if you watch the videos, that's the number one reason that people get readmitted into a hospital after being discharged from a hospital is they're having some type of skin breakdown issue, and that is primarily caused by friction and moisture. So one of the things that you also get when you're buying high-end mattresses and getting hospital grade equipment are surfaces that we call no shear, meaning that there's very little friction on the skin when you're sliding in and out of bed. And that's also, true for Hoyers. And if you're doing that, you've got, other features and things that go with that. Now, all these Hillrom beds are going to come with the same basic features. And we've done this in previous videos, but we are going to do it again where you've got the chair position. So what I did in this video is I tried to put all these beds into a chair position. So you can see that you can sit fully into a chair. Now, some of the beds, like the ones over here, the Centrella and the VersaCare, you're still going to get out of the bed off the side of the bed. But with all the different versions of the Progressa bed, you're going to basically be able to sit down and get in it just like a reclining chair and then get out of it or go all the way back into a chair position. Now, I've been doing this for 15 years. We sell hospital beds by the thousands, and we're one of the number one exporters. We ship these beds all over the world. We equip hospitals all over the world. So we know a lot about these beds and these different bed models. And it's important, once again, to make sure that when you're getting a bed, you're getting the right bed for you at the right price range. There's different versions of the Progressive bed, which, once again, we've got over here. This is the Progressive bed with the treatment surface. You can see it says therapy. And what that actually is a low air loss alternating pressure mattress. And then over here, um, the magenta one that's right here and be directly behind me, that mattress has the pulmonary feature, meaning that it'll help knock congestion out of the lungs. So for people with COPD, um, uh, um, different types of lung issues like pneumonia or bronchitis or whatever it might be, you've got a pulmonary feature. That's the only bed that we have that'll perform a pulmonary feature. So if there's anything that's lung related, that is going to be the best bed for you. And then we also do have, as I showed over here earlier, we do have a version of the Progressa now, which is a foam mattress version. And, that would just be for, people that just want a really comfortable bed that sits into a chair. So the primary features that every bed has is power up and down, power head and foot up and down, uh, power Trendelenburg, which is reverse Trendelenburg and Trendelenburg, where the foot's above the head or the head's above the foot. Foot above the head, as I mentioned in a previous video, is kind of nice because it helps slide you down in bed. If you're sliding down in bed, you can lift the feet up above the head. However, it's also used for people that have a lot of issues with maybe say lymphedema or issues with gout where there's a lot of swelling in the feet. By elevating the feet above the head, it helps get some of that back into circulation and it helps the body sort of start moving some of that material around. And then you've also got the chair position. And as I've said in previous videos, if you have Trendelenburg, you always have a chair position because a chair position is really nothing more than a bed that's in that Trendelenburg feature with the head above the foot. And then you just put the head section up and put the foot section up. And Trendelenburg and some of those features, the reverse Trendelenburg with the head above the foot, is ideal for cardiac patients. A lot of people with cardiac related issues need to be at a 30-degree or higher position above the foot. So it measures all that. It lets you know how to use it. So, the goal of this video right here is to just give you a look at some of the beds that we carry. I kind of move them around. I'm like, okay, I got to make sure that you can see these, but it's important to note that there's different options, different features. And like I said, we have the Secure 3 beds, which, these are over here, which we can equip with foam or air. And we carry a lot of beds. Ultimately, though, there's going to be beds that we won't have because over the years we've found them to be problematic. We're not real happy with the backside of their service. Some might require more service than others, I guess is probably a nice way of saying it. So there are bed models that I don't have in here because they're not on my most favorite list, and I don't want all beds that for whatever reason the manufacturer might have had an issue where the control board goes out or whatever it might be. And we know that ahead of time. The other thing is that with the Hillrom beds, we have technicians and we have service available anywhere in the United States. So, you get the bed, and let's say a year or two down the road, there's a requirement for a service issue, then we're able to find and contract and get people out that can service the beds. That's really a big deal. Selling the bed is actually the easy part, but having a really good back end where we're able to support the bed once the sale has been made, that's really probably the most important thing to take care of and to make sure we have that in place. And that gives peace of mind to the people, obviously, that are purchasing the beds. And we do have certified Hillrom technicians that go through all these Hillrom beds. So we make sure that the bed is what we call patient ready, whether it's going back into a hospital, whether it's going into a nursing home, a long-term care facility, a nursing school. We make sure that we go through the beds, that everything is certified and patient ready. So with that being said, we've launched the Mr. Hospital bed. So, if you followed our channel, I've got hundreds of videos on YouTube that I've done, and I do complete breakdowns on every bed. I'm going to be doing one after this video on the progressive bed and its features, but it's also, important to know that, we're able to not only sell beds, but we can answer questions. We've got multiple beds in different price ranges, like the VersaCare bed. This bed right here is going to be a very affordable starter bed. That bed, is going to come in at a lower cost, whether it's with foam or air. And as I said before, there's a huge difference when you're getting an air mattress system between a hospital grade air mattress system and a home care system. Now, there are some home care brands and there are some home care products that are like right on the edge. They're really high end, they're good for home. They wouldn't make it into a hospital, but they're still really good and they're going to prevent skin breakdown. The number one thing that I've talked about many times is low air loss. Low air loss is basically a feature that runs air over the surface of the mattress. That air is there to whisk away moisture to keep skin dry, and dry skin basically reduces the risk of bed sores. And then also, if there are bed sores, there's always moisture surrounding that. It's going to get in there and help dry that wound up. And that is basically what we call a wound care treatment surface. And if you can see, maybe you can't, but I'll show you right here on this VersaCare bed, it says P500 air surface right there at the bottom. I know it's kind of small if you can't see it. That's a version of the VersaCare. The VersaCare bed was made for about 12 years. That was the only time they ran a low air loss mattress surface on a VersaCare bed. So there's a difference between air and low air loss. And, low air loss would be something that they would use in a wound care department, but the regular air mattress would be, primarily used for short-term stays, what have you. Air mattresses also, in addition to having different features, that one feature they have is called Turn Assist. That will help turn the person to the left for about 15, 20 minutes. And it allows the nurse or the caregiver to change out bed linens. And then it also helps to bathe the person. So the bed will turn over and then go flat back again. And so all versions of the VersaCare bed will have that. The P500 is the only one that's really going to have the low air loss feature. And so if there is a risk of bed sores, if somebody you're taking care of or you're watching this video and you're starting to experience that. This is a mattress surface that's ballpark going to come in, at a lower price range. I don't really quote prices out because the videos are up there for years and people watch them and that price can change from time to time. So I don't really want to get in there, but that would be entry level. And that's getting that mattress and this system behind me, that VersaCare bed brand new is about 18 grand. So you're getting $18,000 worth of value for a fraction of the price, but you're getting hospital grade care. And so, there's semi-electric beds out there. Your insurance company usually is going to provide something that's going to be very basic. We call them the brown beds. You probably have all seen them. I used to have one in here that we used to kind of use as a demo bed to really give you a clear difference between what those beds look like. But anything that we're selling is going to be full electric and it's going to be hospital grade. And so, home care stuff can come in at a very low price. They'll say, hey, we've got low air loss. And it does, it has low air loss. But the problem is that the pump is so small and the amount of air that's circulating over the mattress is so minimal that it's really not doing a sufficient job to prevent or treat a bed sore, pressure wound, skin ulcer, or any of the other words or adjectives you want to describe for skin breakdown. And so that's really where we specialize in good, high quality equipment and the higher grade home care stuff, right? So there's Prius, Protect, there's Invacare. There's a lot of companies that sell different equipment, and we go through and evaluate, what is really going to be something that's going to prevent skin breakdown, or if there is skin breakdown, what are we going to be able to provide to that customer to make sure that we're giving them adequate care to help them. And so, we sell Hoyer lifts, and we do sell, foam mattresses separately. We sell air systems separately. And I could take also, like I said earlier, I could take this Secure 3 bed right there with the orange. That's that gel foam mattress. We're gonna have another video on that later. But I could take that and throw a brand new, really high-end home care system on that, and you've got a system at home that is super high quality. So, the goal of the channel is to give you knowledge and information. The goal of the channel is to help find a hospital bed that's right for you. And, we want to make sure that you're getting the best value, the best quality. And as somebody that goes into hospitals and takes beds out by the hundreds, I can tell you that there's not a lot of companies that do this nor want to do it because it's very labor intensive. It requires a lot of, storage. There's a lot of stuff that goes into it. It's much easier to sell a low end home care bed that comes in a box that weighs 125 pounds that you can assemble and ship easily. That's not our thing. I mean, technically, we might even have some of that on our website. I don't know, but if they put it on there, it's not our specialty. We're doing that as a favor to the end user to give you options, because if you broke a hip and you're doing a hip replacement, or you're doing something along that line, then that bed actually might be good for you, because you're only going to need it during a recovery time frame of maybe 30, 60, 90, 120 days. If you got a knee replacement and you need something electric, there are times when those beds are good. Like, there are times when we get phone calls and this person's up, 4 floors up in a little tiny apartment area with a very small elevator. These beds are going to be very difficult to get in there. That progressive bed is a 600 plus pound bed. And all the beds we sell that are hospital grade are ballpark around 500 pounds each. So these are solid steel frame beds, but they come, like I said, with a lot of features. They come with a lot of value. And a lot of the times you're getting a lot more value from these beds at a refurbished, used hospital bed price than you do when you're buying something brand new. And like I said, this isn't about, saying this one's better than that one all the time, because there are times when just a full electric home care bed that's a little bit less toned down and it's not such a medical type looking bed is actually good. And we also do sell the adjustable semi-electric beds for home use that are non-medical, although we equip them with grounding sheets, grounding blankets. We equip them with a lot of technology. We are actually one of the most cutting edge companies in the United States when it comes to med beds, med bed technology. I don't know if you can see this. I'll try to show it to you. But back in there is a room that is a med bed back there. Um, that's a whole room that's full of Tesla technology and other equipment that we specialize in, because every day we're taking calls from people with, paraplegic, quadriplegic, stroke, ALS, MS. So we're used to dealing with very high-end patient care needs. We sell a lot of extra wide beds, which we would classify as bariatric beds, and we have mattress systems, and we have all the different things we need for those as well. So my name is Sean Callahan, also now known as Mr. Hospital Bed. We're here to serve you. We're here to provide you the highest quality equipment at the best possible prices. Give us a call for more information. We're located in San Diego, California. Our number out there is 858-263-4894. We're also in beautiful Richmond, Virginia, where we've got the showroom here that we're in. And our phone number here is 540-327-7376. And as you can see, Hillrom today is one of our main products. I mean, we sell a lot of Hillrom beds. They make a phenomenal bed. Nothing really can touch a Progressa. I mean, there's a lot of good hospital beds out there. There is nothing not made by Lynette, Stryker, Invacare. Nobody can touch the Progressa. And the Progressive bed with the pulmonary surface, this one right here, will turn the person all night long. We're going to do some more videos on that bed. I've thrown some clips in. The Progressive bed here with the treatment surface, low air loss. Maybe you don't need percussion, save some money. And then, of course, as I showed earlier, we've got the Progressive bed with the foam mattress, which is a great bed if you need a full chair position. So give us a call for more information, share your questions, give us some likes. Anything you need, give us a call. We're more than happy to help. We ship beds all over the country. Today, as we speak right now, we've got deliveries going to Maryland. We have deliveries going to Ohio. We have Illinois, Alabama, and 2 beds going into the Tennessee area. So we ship and sell hospital beds all over the United States and all over the world. We fill up 40-foot containers and ship them to Africa. We ship them to Mexico, Latin America, all over the world. So we are the leader when it comes to real high-end home care beds, hospital beds, actual hospital grade beds. Give us a call for more information. We appreciate you watching the video, and we'll look forward to seeing you on the next one.